Sanitation is one of the basic determinants of quality of life and Human Development Index. Government of India has developed programs to ensure all Indian cities and towns must become totally sanitized, healthy and livable, and ensure and sustain good public health and environmental outcomes for all their citizens, with a special focus on hygienic and affordable sanitation facilities for the urban poor and women. This presentation covers all the aspects of sanitation conditions in India and further illustrates the effective approach to improve sanitation conditions. India's first nationwide program for rural sanitation, the Central Sanitation Program, was launched in 1986. The basic objective of this program was to improve the quality of life of rural people and to provide privacy and dignity to women. Sanitation is the hygienic means of promoting health through prevention of human contact with the hazards of waste. Hazards can be physical, microbiological, biological, or chemical agents of disease. Waste that can cause health problems are human and animal feces, solid waste, domestic waste, water, industrial waste, and agricultural wastes. Hygienic means of prevention can be by using engineering solutions, example sewerage and wastewater treatment, simple technologies, example septic tanks, toilets, or even by personal hygiene practices, example simple hand washing with soap. Now, let's take a look at world sanitation conditions. In 2008, 87% of the world's total population had some form of improved water supply, while 61% had access to basic sanitation facilities. Inadequate sanitation, hygiene, or access to water increases the incidence of diarrheal diseases as well as death. 2.5 billion people in the world do not have access to adequate sanitation. 1 in 3 of the world's population, as stated by WHO or UNICEF Joint Monitoring Program Report 2014. 748 million people in the world do not have access to safe water. This is roughly 1 in 10 of the world's population. Around 5 lakh children die every year from diarrhea caused by unsafe water and poor sanitation. That's over 1400 children a day, committing to child survival. As stated by Committing to Child Survival, A Promise Renewed, Progress Report 2014, UNICEF, September 2014. The highest proportion of death as well as highest absolute numbers occurs in countries with high mortality patterns such as in Africa and parts of Southeast Asia. Most diarrheal deaths in the world, accounting to 88%, are caused by unsafe water, sanitation or hygiene. The Millennium Development Goal by World Health Organization's target is to reduce by half the proportion of people without access to basic sanitation by 2015. The number of people without access to sanitation conditions have increased due to slow progress and population growth. Now let's take a look at specific conditions of sanitation in India. Drinking water supply and sanitation in India continue to be inadequate despite long-standing efforts by the various levels of government and communities at improving coverage. A number of innovative approaches to improve water supply and sanitation have been tested in India. The government of Delhi decided that beginning on 1st January 2014, it will provide 666 liters of free water every day to households with functioning water meters. UNICEF's long-standing support for improving water supply, sanitation and hygiene stems from a firm conviction and based on sound evidence that these are central to ensuring the rights of children. In fact, it is essential for children to survive, grow and develop into healthy and fulfilled citizens of the world. In the broader context, UNICEF's activities in water, sanitation and hygiene contribute to the achievement of the Millennium Development Goals. Hand washing with soap, particularly after contact with excreta, can reduce diarrheal diseases by over 40% and respiratory infections by 30%. Diarrhea and respiratory infections are the number one cause for child deaths in India. Hand washing with soap is among the most effective and inexpensive ways to prevent diarrheal diseases and pneumonia. Considering the rural sanitation conditions, it has been observed open defecation is a huge problem in rural areas, though it has reduced, but the practice has not completely vanished. Lack of priority to safe confinement and disposal of human excreta poses significant health risks manifest in the sanitation challenge facing the nation today. It is estimated that 1 in every deaths in India in villages is linked to poor sanitation and hygiene. Diarrhea is a preventable disease and is the largest killer and accountable for every 20th death. Around 4,50,000 deaths were linked to diarrhea alone in 2006, of which 88% were deaths of children below 5. Studies have shown that the education of children, especially the girl child, is also significantly impacted by poor sanitation. Another impact of poor sanitation and the resultant illnesses is the loss of productivity of the family members. It is also known the lack of adequate sanitation leads to significant losses for the country. The adverse economic impacts of inadequate sanitation in India, as reported in the study, based on published details like sanitation coverage, child mortality rate, etc., as of the year 2006 was of the order of rupees 2.4 lakh crore per person. India has shown high country commitment to sanitation with increased support to India's rural sanitation flagship program, Total Sanitation Campaign. The National 5-year plan documents and annual plans and budgets at the national and state levels recognize the rural sanitation vision and plans and allocate considerable resources toward their achievement. Now let's take a look at financing scenario in rural sanitation sector. The rural sanitation sector has continued to receive increasing budgetary support. The TCS or Total Sanitation Campaign annual budget has increased to rupees 16,500 million, up from an annual budget of 12,000 million in 2008. Further, as per the Sanitation Strategy 2012 to 2022, an additional final outlay of rupees 470 billion has been identified to be utilized over a decade to achieve the objectives of cent% rural sanitation. This only indicates the 65% of the total outlay on rural sanitation sector from the central government, the balance being contributed by state governments and beneficiary households and communities. A comprehensive system to improve the sanitation conditions has been developed for the effective implementation of the programs, including utilization of funds through periodical progress reports, performance review committee meetings, district level monitoring and vigilance, and monitoring committees at the state or district level. Besides this, the program adopts a 5-pronged strategy consisting of creation of awareness about the schemes, transparency, people's participation, accountability or social audit, and strict vigilance and monitoring at all levels. In order to promote urban sanitation and recognize excellence in performance in this area, Government of India has instituted the Nirmal Sahar Puraskar, a biannual exercise that recognizes sanitation initiatives of cities. The award is based on premise that improved public health and environmental standards are the two outcomes that cities must seek to ensure quality of life for urban citizens, and that a periodic assessment of the performance of cities that is made public will lead to greater public awareness and competition among cities. The award scheme is recognition of the city for the management of human excreta, treatment and recycle of wastewater, solid waste management, storm water drainage, operation and maintenance of the sanitation and storm water infrastructure, and improvements in water quality. Now, moving to slide 10, let's understand the role of government bodies in sanitation sector. The responsibility for provision of sanitation facilities in India is decentralized and primarily rests with local government bodies, that is government panchayat, Gram Panchayat in rural areas and municipalities or corporations in urban areas, the state and central governments have a facilitating role that takes the form of framing, enabling policies or guidelines, provides financial and capacity building support and monitoring progress. In the central government, the Planning Commission through 5-year plans guides investment in the sector by allocating funding for strategic priorities. The solid waste management is the primary responsibility and duty of the municipal authorities. State legislation and the local acts that govern municipal authorities include special provisions for the collection, transport, and disposal of waste. They assign the responsibility for provision of services to the chief executive of municipal authority. Sanitation remains one of the biggest development challenges in all developing countries. Improving sanitation is the key to achieve the health-related Millennium Development Goals of reducing child mortality and combating disease. However, these outcomes will remain pressing and persistent concerns for many nations even as they approach the goal of halving the number of the world's poor by 2015, which in turn will have considerable bearing on the progress of attaining this goal by itself. A focus on appropriate outcome-oriented approaches to rural sanitation is critical given that a majority of poor households continue to live in rural areas. Sanitation programs must be implemented strategically to upgrade and improve the sanitation conditions in India. Sanitation programs work upon creating a demand for safe sanitation services. It can be done through social marketing of sanitation and behavior change communication for rural sanitation. By meeting the demand for safe sanitation services, once the demand has been created, ensuring delivery of these services through capacity building of mission and providing a wide range of suitable sanitation technologies, and by ensuring sustainability of sanitation infrastructure and behavior. Institutional policy and other measures to ensure sustainability of sanitation infrastructure and behavior. Also, proper education should be provided to the people, especially the illiterate and poor people. People should be encouraged to keep the city clean. Media should be used as a medium to encourage people. Government should be cautioned. Donation towards the betterment of the society must be done. Providing adequate sanitation will have profound implications for the human health and poverty alleviation. Access to adequate sanitation literally signifies crossing the most critical barrier to a life of dignity and fulfillment of basic needs. Focusing on youth and using education, and finally taking the responsibility for the environment. This was a brief discussion on sanitation conditions in India and initiatives taken to provide better hygiene facilities to all. In the next week, we will discuss about disease prevention strategies. Thank you.